Hello, and thank you for tuning into this very important announcement I have. This announcement can influence your life and the life of your children for as long as they may live. It really is a matter of life and death, um, and we need to make sure that everybody that we can communicate to between the age group of 15 and 24, as this is the most common age group that you can be infected. More than half of these cases each year come in from this age group. So make sure that if you're within these brackets from 15 to 24 that you're paying attention. It is about the STD that has been rampantly spreading across the country of gonorrhea. Gonorrhea is an infection of both male and female of the genitalia, rectum, and throat. It is a Gonococcus neisseria gonorrhea that cost the government and personal entities $16 billion each year in medical funds. There are 26 million new cases in 2018, and 1 in 5 people in America can contract this virus. And it's spreading, and we need to make sure that we are aware of how it travels from person to person. You can contract the infection by having anal, oral, or vaginal sex with somebody that is infected. Mothers that are pregnant can also spread this to their children through pregnancy. There are several symptoms and signs that you have contracted this STD. Oftentimes, gonorrhea has no symptoms, but it can cause serious health problems even without the symptoms appearing. It does display differently in both men and women, and most women with gonorrhea do not have any symptoms. Even when the woman has symptoms, they are often mild and can be mistaken for bladder or vaginal infection. Symptoms for women can include painful or burning sensation while urinating, increased vaginal discharge, and vaginal bleeding between periods. Men do experience these symptoms differently. They also have a burning sensation while urinating, a white, yellow, or green discharge from the genitalia, and painful or swollen testicles, although this is a less common symptom. Rectal infections that can influence either men or women can cause no symptoms, and they also, some things that come along with this is discharge, anal itching, soreness, bleeding, or painful bowel movements. This STD does differ between men and women. In women, it is the most common case of the pelvic inflammatory disease. This causes gonococcal salpingus, which is a swelling in the fallopian tubes. This can cause several things down the line, including scarring of the fallopian tubes, which means whenever you do have a baby or when you are pregnant, it can potentially get stuck in the fallopian tubes because of scarring, and this will cause miscarriage. If there's complete scarring and blockage, it will cause infertility. In men, it is less likely to be asymptomatic. The scarring may block the duct system, which will also cause infertility. There are several ways that we can test. The most common you can receive your diagnosis is when the gonococci is tested from the site and it tests positive. Another way is that you can find it in your bloodstream if it is severe and is spreading enough. For treatment, there are ways that you can treat it. You can take certain antibiotics to stop the infection, but the damage caused is irreversible. It is developing some resistance in some areas, so you need to make sure that you are aware of this and that it is a growing concern, but you should be continually tested to make sure there's not a resurgence. There are several ways that we can prevent this, and this is by far the most important thing that I can tell you today. One way to prevent having this STD is to not have sex or be abstinent, wearing a condom properly. Another way is to have a monogamous relationship with somebody that has recently tested negative. This is a rampant thing growing across the country and affecting lives and changing lives all the way around. So if we can do anything and team up together to prevent this, this will be a great cause. Thank you.